MPN patients are becoming more and more well-informed, and they are I've found them just an ideal population to deal with. You have to remember that this, except for primary myelofibrosis, this is a marathon, not a sprint. And you listen to the patients, and you explain to them what's going on. I find that listening to the patient is a great way to treat the patient, and not automatically say you have to be on this drug because the World Health Organization or the ALN says you must be on hydroxyurea. I spend my time taking people off hydroxyurea, and I get a big email traffic of people telling me, well, my physician says I'm only going to phlebotomize you to a hematocrit of 45%. No, listen to the patient. Women, you have to take them lower, as I've said before, but patients will tell you when they feel better. And they shouldn't have to argue with their physician because someone set a hematocrit threshold. You can't hurt people with phlebotomy. I phlebotomize my pregnant patients down below 34%, because during pregnancy, you can't tell what the hematocrit is. And people say, well, the fetus won't get its iron. The fetus always gets its iron, you know. And patients with, say, beta thalassemia trait go through pregnancy sometimes with hematocrits below 30%. You're not going to hurt the patient, you're going to protect the patient, which is the most important thing.